Those flashy grocery cards and flex cards you've seen advertised all came from a temporary experiment by CMS, and that all comes to an end in 2026. So what stays, what goes, and what do you need to know? Hi, I'm Larry Goist, owner of LMS Insurance Group, where we help seniors navigate the Medicare Maze. So in today's short video, I'm telling you guys all about the value-based insurance design that comes to an end in 2026. And I'm going to cover three real basic topics. So number one, I'm going to explain the difference between the value-based insurance design and SSBCI benefits. Number two, I'm going to tell you who this is going to affect the most. And then thirdly, I'm going to tell you some other ways that you could be eligible for those grocery cards and flex benefits. And that's all coming up next. Hey, before I dive in, don't forget to like our channel. Definitely subscribe if you find this content helpful. I really appreciate you doing that. Okay, so to follow this video, you'll have to understand two real basic concepts. And that is that there are two ways in which people on Medicare can get food cards, transportation, and extra benefits. Now, the one was through what's called the value-based insurance design, okay? And this is what's going away in 2026. Now, the other way you qualify for a monthly grocery card or a flex card is through a different benefit, which is an SSBCI. So SSBCI stands for Special Supplemental Benefits for the Chronically Ill. So right now, if you're getting a grocery card or a flex card, it's under one of these two designs. You're either eligible through the VBID or you're eligible through SSBCI, okay? But that's how in 2025 people are getting grocery cards and flex cards. Okay, so the VBID, the value-based insurance design, started in 2017. And this made it to where if you were low income, like being low income would qualify you for a monthly grocery card. So if you were dual eligible, if you had Medicare and Medicaid, every one of these plans came with a monthly grocery card because with the VBID, they were able to give these benefits to people just for being low income. So the last few years, everybody that's been on a dual plan, Medicare, Medicaid, they've all gotten some sort of a monthly food allowance. They didn't have to have a chronic condition. They didn't have to have anything wrong with their health. Just the fact that they were on a dual plan meant they were low income. And because they were low income, the VBID allowed them to have monthly grocery cards and flex cards. So this program ends December 31st, 2025. It is no longer. So in 2026, if you're low income, that in itself is not going to qualify you for a monthly grocery benefit on a Medicare Advantage plan. Okay, so what about SSBCI? Well, again, that's Special Supplemental Benefits for Chronically Ill, and this was signed into law in 2018. Now, this was permanent, and this is staying. So what SSBCI does is it says if you have certain chronic conditions like heart problems, diabetes, kidney problems, COPD, right? A whole list of different conditions where it said if the beneficiary has that type of condition, you can offer them a grocery card to improve that condition, or you can offer them different benefits like transportation and all the other things that came with the SSBCI. So that is staying, where if you have chronic conditions, you can still be eligible for the monthly grocery or flex benefit, whatever you want to call it. So why is CMS ending the value-based insurance design? Well, in short, they said it's just too expensive. Offering these benefits to such a large group of people, they said, cost them over $2 billion over the duration since 2017. So they're saying it's just too expensive and it's not actually improving the quality of care that these individuals were getting. So services like transportation, food cards, and care coordination, right? those will not be offered anymore on a Medicare plan unless you have a condition that falls under the SSBCI criteria. So who will be affected most by the elimination of the value-based insurance design? Well, to me, it's clear it's going to be dual eligible individuals because, since 2018, we have seen if somebody has Medicare and Medicaid, whether they have chronic conditions or whether they don't, they would get a large monthly grocery benefit. Where in now 2026, to get that grocery benefit, they have to tie the grocery benefit to some kind of chronic condition. So people that have Medicare and Medicaid are definitely going to be the people that are affected the most, as this group always got a monthly grocery card, which now the majority of people still will get a grocery card, but if you don't have a chronic illness, that grocery card is going to disappear in 2026. So guys, in general, in 2026, you could just expect fewer freebies for all, right? If you're getting these extra benefits, it's going to be tied to a certain condition and not given to a group because of a social detriment or an income level. Benefits are shifting to people of higher need rather than just giving them to an entire group. And because of that, annual reviews are more important than ever. Make sure you do an annual review with your Medicare broker, your Medicare advisor, to see which bucket you're going to fall into for the 2026 year. So guys, in 2026, there still will be food cards and flex cards available. It's just going to be to a smaller percent of the population. As always, if you need a benefit review or need to know what's available in your area, that's why we're here at LMS Insurance Group. I hope this video was helpful. I'll talk to you next time. Larry Goist, LMS Insurance Group.